Good afternoon. Welcome to the National Cancer Institute's latest Facebook Live. Today we will be talking about pediatric and wild-type gastrointestinal stromal tumor, or GIST, from the NIH clinic. My name is Becky Owens, and I am from GIST Support International. I will be today's moderator. As I am an SDH-deficient GIST patient myself, I am particularly interested in the material that will be presented today. Today I'm pleased to be joined by two experts in the field, Dr. Fernanda Arnaldez from the National Cancer Institute and Dr. Margaret von Maren from Fox Chase Cancer Center. Would you care to introduce yourselves?
Of course, Becky. I am delighted to be here today. My name is Fernanda Arnaldez. I work here at the National Cancer Institute, and I have the pleasure of being the director of this GIST clinic. I am a pediatric oncologist and a molecular oncologist, and through many years at the NIH, I developed a strong passion for rare pediatric solid tumors, and that's why I'm delighted to be here today.
And I'm Meg von Maren. I'm a adult medical oncologist working at Fox Chase Cancer Center, and my journey with GIST started about 18 years ago with some of the first trials that tested drugs in this disease, which at the time we really thought of as sort of one disease, and we've really come to appreciate that this is really a set of diseases, one of which we are going to talk about more today.
Thank you both. Today we're going to discuss the GIST tumor treatment as part of the NIH GIST clinic. The clinic brings together patients with GIST tumors as well as specialists in the field, and I welcome what promises to be a very interesting discussion. In conjunction with the topics that will be discussed in this broadcast, we encourage you to ask questions and comments of this video. We ask that you keep your questions and comments to today's topic. If we do not get your questions during the event, we will answer them as soon as possible in the comments. As a reminder, we cannot answer questions about your treatment publicly. Please talk about these questions with your treating physician. Additionally, if you have further questions, you can contact the NCI Contact Center at 1-800-4-CANCER or by visiting cancer.gov/contact for live chat help. Okay, let's get started. Can you both give an overview of what GIST tumors are and what happens when diagnosed?
Sure. Well, GISTs are a set of cancers that arise really anywhere along the GI tract. So the esophagus, which is the tube that connects your mouth to your stomach itself, your small bowel, large bowel, and then the rectum at the end. They happen to be different from your typical colon cancer or gastric cancer, really because of the types of cells that make up the tumor.
Right.
And they are what we call mesenchymal tumors, and GIST are the most common mesenchymal tumor of the intestinal tract.
It's interesting because even though all what Dr. von Maren just said is totally true, what is also true is that we don't know exactly how many new cases per year are being diagnosed in the United States. And we know that because there are some studies of autopsies where we have found that many small tumors have been found in a subset of the population, and they never got the patient into any kind of trouble or symptoms. So today, we are going to talk about the minority of these GIST tumors. I would say anywhere in between 85 to 90% of them are very well characterized by alterations in two distinct genes called KIT or PDGFRA. And a smaller percentage do not. And that's why we call them wild type in the clinic. And we are here today to discuss those type of tumors.
Now, what would lead someone to suspect that they might have a GIST tumor?
So patients present in a variety of ways. Sometimes it's just a feeling of my stomach isn't quite right. I'm feeling full more quickly when I'm eating, some nausea, some stomach discomfort. Sometimes it's just fatigue, something very nondescript like that.
And that fatigue can be related to bleeding. These tumors can get ulcerated in the surface of the stomach or anywhere anywhere in the digestive tract where they are at. And this slow trickle of red blood cells and loss of iron makes you feel really tired, because what is really happening is that there is a profound anemia. And in a smaller number of cases, what happens is a brisk bleeding that can lead to the patient to go to the emergency department, and that can be a problematic situation.
Now, how is your doctor sure that they've gotten the correct diagnosis of GIST when diagnosed?
So I think a lot of times when patients present with these symptoms, particularly the anemia, we look to our gastroenterology colleagues or GI colleagues who, using endoscopy or taking a look inside in the stomach or inside in the colon, look to see, can they find anywhere where there's bleeding? Sometimes we don't always see it. Sometimes there's just the tumor pushes into the stomach or into the bowel. Because unlike colon cancer or gastric cancer, these tumors arise on the outside of the wall rather than inside. So they need sometimes another technique, right?
Yeah, and what happens is that the endoscopist, sometimes what they can see is that these tumors are pushing against the wall of the stomach, and the lining of the stomach becomes ulcerated and it bleeds. And that's also a cue that something like this could be happening. In any event, the only way, Becky, to be sure is to take a small piece of that tissue, that's called performing a biopsy, and to have a very experienced pathology looking at it and making the final diagnosis.
Yeah. Which is really important because it could be some other type of tumor, and the pathologist will use special kinds of stains to check to see if there is expression, if these cells have certain proteins or sugars on the outside of the cell or the inside of the cell, and they can do that with these stains, and that helps them sort out that this really is a GIST or it's not, it's another type of tumor, or sometimes it also helps them characterize the different types of GIST, including the wild type GIST that we're talking about, like your type of GIST.
And we have learned over the years that typically these tumors that are wild type, when we look for certain proteins on the surface by special stains in the pathology lab, in this case SDH or succinate dehydrogenase proteins, the expression is lost, meaning we stain it and we cannot see them. And that's actually a very important cue that something might be happening at that level and help us to take the diagnosis a step further.
Now, is there a trend in the typical age of diagnosis according to different types of GIST?
So when I started out in the field, and if you look at the review articles, the median age of diagnosis or the time when most people were diagnosed was around 59, 60, so sort of an older patient population. But I think one of the things we've come to appreciate, particularly with the wild type group of patients, is that these patients tend to be younger, and on average probably a decade or more younger. And really one of the reasons why this clinic started, because we started looking at those patients in particular whose tumors started when they were in the pediatric age group.
That's right. That's why there is a pediatrician at the table, Becky. It's interesting. More than a decade ago, colleagues around the country found out that these patients had gastrointestinal stromal tumors in the pediatric age, and quite frankly, we knew very little about what to do with them because it's quite rare. So that's how we started to get together, and we finally established this multidisciplinary clinic here at the NCI, where colleagues from all over the country come to meet a group of patients and try to give the best impression they can have about their management.
Can you tell us any more about the clinic? Who attends? How? What it is?
Well, it has been evolving over time. Initially, we had clinics once every 6 months. Now we think that an annual clinic is really sufficient. And we really reached out to colleagues in the most important centers around the country who had a wealth of expertise managing these tumors. And when I say colleagues, I am not only talking about physicians. In our clinic, there are physicians geneticists, genetic counselors, physical therapists, psychologists, a big group of people who really try to make this clinic a success. And the operations are quite complicated, as you very well know. But so this is the way the clinic functions, and we are really in debt to all our patients who come every year to share their stories, their journeys, and from whom we can learn a lot. And I really think, Becky, that this clinic has been successful in part because of the tremendous impact of the advocacy community who has embraced it from the very beginning.
Yeah, no, definitely. I can sort of remember when I was initially invited thinking, I'm not a pediatrician, why do you want me to come? And I think for me, it's really been important to learn that, you know, this pediatric subgroup that had some very special characteristics that are maybe different from most adult wild types. For example, what we used to call the pediatric, which now we think of more as the wild type, you know, they tended to be younger. Many more of them were female rather than male.
That's right.
They often were in the stomach. Sometimes they had multiple spots. Their tumors sometimes were in lymph nodes, which we rarely see in other types of GIST. So some characteristics that were very clearly defined in the description of pediatric GIST, really we've come to appreciate it's not just about that age group, it's really about the type of tumors, the wild type tumors, which we can see in older individuals.
And again, the clinic has been evolving over time as it has the knowledge that we have gathered about the disease. But I would say that the common factor is the deep passion all our colleagues share about this. They all put a lot of energy into this, and one of my colleagues called it the most fulfilling medical experience of his life. And I'm talking about a very accomplished colleague. So that makes us really, really proud.
Yeah, so I think one of the other things that is really enjoyable for the people who come to participate is for the patients and their families who often come from, you know, multiple areas in the United States and sometimes from other parts of the world, who have never met another GIST patient, let alone another wild type GIST patient. And so here they are, they've come to a place and they realize they're not the odd person out. They're one of, 20 people with this diagnosis who are at the clinic. And I think for them and their families, it's really a very supportive environment. And they learn from each other, they learn from all the specialists that they meet, and as a specialist in this area, I learn so much from them, and it goes both ways. It's really fun.
It does go both ways.
Yes.
Can you tell me what other uses or applications has the GIST clinic had?
Wow, that's critical. I think we can talk about it at two different levels in terms of GIST care and in terms of other diseases. And if I start by the last one, I think that this is really defining, and it wasn't our intention at the very beginning, but it's defining a model of care where we have a really close multidisciplinary embrace of these patients with a rare disease. And in the context of the Cancer Moonshot Initiative, the NCI is very seriously taking this approach to other rare diseases, essentially because it has worked, and we think that is a critical contribution that we have to the oncology community in general. But then there are other things that were an advance in the context of GIST care, right, Meg?
Right. Oh, definitely. I think the clinic, allowed for pulling together lots of patient tumors and samples and clinical histories that allowed a better definition of what the tumor is, how to take care of it, biologic features of these wild type GIST patients, and so it's allowed several very meaningful publications to share with other colleagues. How do we take care of these patients, particularly with surgery, which we think of very differently for this type of GIST compared to other types of GISTs. So even in this one tumor that we have the same name, we treat them very differently.
Well, Speaking for myself as a patient advocate, there's a very strong GIST community, patient community, and we're very grateful that we have participation in the NIH clinic each year, as it allows us to not only donate tissue for research and participate, but also to meet each other, which is very important. There's a very important aspect when you have a connection when you have a rare cancer, and we're very appreciative of all the work that you do. I'm able to attend as a representative of GIST Support International, as well as a newly formed group called the SDH Cancer Research Advocates, the SDHRA. And each of these sites have a website which is informational and educational to patients. So you can go and search if you have a topic you're interested in to learn more. The groups also have listservs where everyone can talk and you can share information and appreciate that others are going through the same battles that you are. Many times answer questions you may have worries about. So it's very helpful. And both of the groups have Facebook pages if that's your preferred format for communication. But I'm very grateful for the patient support groups in my life, as they've played a large role in my journey. And I find it very important to interact with other patients and to interact with each other at the NIH clinic, and we appreciate all that's done. So.
Well, you know, it's really, I think medicine in general has been evolving to a way more inclusive model, and to consider all of us members of the same community is really a critical aspect of this that goes beyond GIST.
Mm-hmm. It does. So are there any GIST, SDH deficient, or wild-type GIST trials that are active?
Okay, yes, let's go there.
I was fortunate to test a drug called linsitinib, which was really the first trial that asked the question, can you do a study in wild-type GIST? It was a study that tested a drug based on some biologic findings that one of my colleagues had identified. And the study was not as successful as we would have liked, but we really learned a lot. And the first thing that we learned is that we're able to do a study in this very rare subtype of GIST. It was actually surprising to us how quickly we were able to enroll patients. And I think in part it was because of advocacy groups that let people know about this, and also because of the GIST clinic that also shared the information. But the NIH has also had various studies.
You know, and again, completing a study in such a rare population, if we are just talking about numbers, it's a major undertaking. And we did have, we completed a trial with a drug called vendatinib, you remember, where we put the preclinical data that we had from models similar to GIST, because unfortunately preclinical models of GIST are still lacking, and that's a big area of research that we are trying to fulfill. But this trial with vendatinib, again, unfortunately was not as successful as we could have expected. But we were able to enroll, we were able to accrue, and we continue to incessantly work to find therapeutic strategies that could benefit the wild-type GIST population. Currently, we do have a trial open. It's using a drug called guatecytabine, and it's sponsored by the Cancer Therapy Evaluation Program. And what this drug does is to take advantage of some characteristics of these tumors that are called epigenetic, meaning something that is not working right, but is not necessarily in your DNA, not necessarily in genes. It's too early to tell whether this is working or not, but we are putting a lot of effort into making these options available to the GIST community.
Thank you.
Sure.
I see we have our first question.
Already?
Is it possible to be diagnosed with GIST as an adult?
It sure is. Just to be clear, you know, when we talk about GIST, there's the more common GIST with the mutations that we talked about, KIT and PDGFR alpha. But certainly adults can be diagnosed with wild-type GIST. It's more common to arise in the stomach, usually always in the stomach, and one of the things that as an expert I try and help colleagues around the country remember is that it's important to test any GIST tumor for mutations. Because if you don't test, then you don't know. And there's also some pathology stains that can also be very helpful. The staining for the succinate dehydrogenase proteins. If they're absent, that also gives you a pretty clear idea that you might be looking at this subtype of GIST.
And this really leads to the importance of a good pathology diagnosis and a good molecular pathology diagnosis, which means how are these genes behaving, which one is mutated and which one isn't, because that really changes today the way we manage disease. It's no longer a research enterprise, it's clinical care. And I think that this is critical. And at this point, Meg is a medical oncologist, I am a pediatric oncologist, but we are treating diseases that are defined by their biology as opposed to diseases that are defined by the age group in which they present. And I think that this is a common theme that we are going to see many of the tumors we handle in addition to GIST.
Okay, thank you. Our next question is, where can I go to get more information about GIST?
There are places on the web, advocacy groups. Certainly the NIH has lots of information about on their website about various types of tumors, including GIST. And then if you are a patient trying to track down somebody who has expertise with GIST. And certainly many of the advocacy groups do sort of highlight the centers where there are physicians who see these tumors more commonly. One of the things that was studied early on was, if you're a routine practitioner, how many GIST cases do you see? Yeah. And the answer is maybe 1 or 2 in your career. When your case is more complicated, you probably want somebody who has a little bit more experience. And so getting a second opinion or being seen by an expert is always helpful for you as the patient to gain knowledge, but then also for your treating physician as well.
And we work in parallel with these treating physicians, and we actually hold relationships with them in terms of patient management, with patients not being necessarily physically here, which again is a really strong bond with the rest of the medical community. In terms of more information, as Meg said, the NCI has resources, the NIH GIST Clinic has a website, and also for all cancer-related concerns, there is a website feature called PDQ, which is curated in real time and really reliable in terms of getting information both for patients and for healthcare practitioners.
And there's a lot of GIST information on the website for GIST Support International. And the address to navigate to find them is it's www.gistsupport.org, or the SDHRA website, which is www.sdhcancer.org. Both are good resources to read more if you'd like to learn. So, okay, our next question is, what are the current treatments for wild-type GIST, and how does treatment differ between adults and children?
So I think this is one of the things that at the clinic we spend the most time thinking about and speaking with patients with. And there's sort of 2 aspects of it that we've really come to appreciate during our time at the clinic. One is the role that surgery plays or doesn't play. A lot of times when people go for a cancer operation, the idea is that you're going to go and take out the cancer, and you want to make sure that the tissue around it is all clean with negative margins. There's no tumor that the pathologist can see, so nothing was left behind. And one of the things that wild-type GIST is different at is that oftentimes it presents with multiple tumors, sometimes involving lymph nodes. And to get it all out would mean a pretty radical surgical procedure, taking out the entire stomach, for example. And it turns out that we probably don't need to do that. It really is not in the best interest of the patient. Being left without a stomach is a very hard life to live. Many patients manage it, but if you don't have to, you shouldn't. These tumors tend to be more slow growing and what we call indolent. They can be there for a long, long time. So to have somebody undergo a very radical treatment like that, big total stomach removal, it probably isn't necessary for their disease. So I think that's one of the important things, take-home messages that we've really learned and we try and communicate with physicians.
Yeah, I think that is critical because these patients live very long and productive lives. So trying to make sure that their quality of life is as good as it could be without compromising the outcome, I think is critical. And I know many of these questions are really geared towards pharmacological therapy. Let me start by saying that there is no drug that has become what we call the standard of care because we know that it's really the perfect drug for it. Having said that, there is a repertoire of drugs that we use and have effects and we can manage.
Mm-hmm. Right. And I think one of the reasons why we don't know so well is, one, this patient population is small. Two, when we were doing sort of the early studies looking at these drugs, the testing for how we look at for these wild-type GISTs, we didn't do. We've been able, in some cases, to go back to these studies and figure out what happened to wild-type GIST patients. But I think as we move forward and drugs are being developed in the future, there'll be more, people will be more conscious of this and think about this group of patients.
And again, developing a drug for a rare disease is not a one-man operation or a one-woman operation. It takes a lot of work, so different stakeholders have to work together. Patients, advocates, physicians, regulatory agencies, government, and industry. So it has to be a concerted effort to pursue drug development in populations that are so small like this.
Okay. Here's an excellent question. Is there any role for radiation in the treatment for GIST?
Yeah. So I love this question because when the first drugs were being developed for GIST and they were such a success, it was almost like the pill was going to take care of everything, and who needs the surgeon, who needs the radiation oncologist? In reality, when people looked, the standard chemotherapies don't work. It was really thought that probably radiation wasn't of benefit, but people have started to look at that question again, and there are certain times when it can be helpful. Some GIST tumors bleed, and it can be helpful to help control bleeding. Some GIST tumors will travel to the bone and cause pain, and so that's another role for radiation.
I agree.
Okay. The next question is, could immunotherapy be helpful in wild-type GIST?
This is a very exciting time to be an oncologist, and quite frankly, we expect that it's going to be a very exciting time for patients. We are seeing advances in immunotherapy that have been absolutely paradigm-changing and mind-blowing. But if we have to learn a lesson from the past, which is when imatinib came to a play and everything was being treated with imatinib, I think now we are seeing such a level of enthusiasm that we really want to make sure that we're using immunotherapy as much as we could. We don't have now enough data to support the use of immunotherapy in wild-type GIST. So really, this doesn't mean yes, doesn't mean no. What it means is we don't have enough models to test it, and I have no rigorous data to be absolutely sure that I can give you a very conclusive answer. We don't know.
Yeah, I totally agree, and certainly clinical trials are a great way to potentially get access to these types of drugs, and we investigators throughout the country and throughout the world continue to ask the question, which types of tumors benefit from immunotherapy? And right now, it's not clear whether GIST is one of those, or at least with the drugs we have available today.
Okay. Someone is asking, if I were a patient coming to the GIST clinic for the first time, what would my experience be like?
You should take this one, Becky. You've done it before. So let me start with the inside scoop, and then maybe you can add from there. So we do have a dedicated team And patients or physicians can refer or self-refer either through the website or, quite frankly, sometimes through emails and phone calls to us. And the typical process is that we try to gather more information, referrals from doctors, scans, pathology slides, critical, because we need to review those and make sure that GIST is actually GIST and wild type is actually wild type. And we have had surprises. And once we gather all those data, there are a couple of things that happen. One is that we contact the physicians if the patient is willing for us to do so, to make sure that we have a concerted plan. Our clinic is annual, but it's meant to give support. It's not meant to give ongoing care, because chances are you need to see your doctor more than once per year. So we do that, and in addition, we invite some of those patients. We have limited slots, and we're trying to improve this situation, but we try to invite those patients who we think will benefit the most from coming. And they come to the NIH for a full 3-day ride. It looks intimidating, what I hear from patients is that it could be at the beginning, but ultimately it's really worn up. And they have the opportunity to meet with different specialists, including, of course, the group of physicians, but also nutritionists, psychologists, genetic counselors. And the most important aspect of this is that Dr. Von Meren and Becky already said, meeting other patients and families and advocates who have had similar journeys to the ones they are living. And that is a critical component of care. And patients over and over again tell us that that is one of the most valuable parts of their experience.
What was your favorite part of coming through the GIST clinic?
Oh, well, I have a couple of things that were my favorite part. One was simply meeting other patients. It's quite the bonding experience. By the end of the 3 days together, you feel like you have a new family, a new group of friends, and we stay in touch. We're all very close knit and follow each other along. The other thing is there's so many specialists and there's so much knowledge base, and they meet together with you and evaluate your case all together, so that you don't have a situation where one doctor might say something, but you wish you would know what someone else would say in reaction to that. They're all together in a meeting. It's very valuable. So you reach a good conclusion, a logical, informed
Thank you, Becky.
Yes. Last question. Where can I get more information about the clinical trials you mentioned so I can share it with my doctor?
So the knee-jerk reaction, the first webpage that I would for sure recommend, in addition to the GIST Clinic website, is clinicaltrials.gov. It is mandatory that any well-designed, approved, regulatory sufficient clinical trial is registered in clinicaltrials.gov, and that is by far the most reliable source.
Right. I think for GIST patients, I've found that many of the advocacy group websites also have a very good list of ongoing clinical trials as well, and I think they try very hard to keep up with the things that are specific for GIST, or even things that might be helpful because of the biology of GIST. So I think, but I agree. That's where I go when I'm looking for clinical trials.
Yes, that's where I go too.
Yeah.
And interestingly, there is always an email or a phone number of contact information of a study coordinator or PI or associate PI, which is principal investigator. So that's a very, very important resource. And quite frankly, I have used it as a healthcare practitioner, emailing colleagues to ask about this trial or another. So I think that that's a very good source.
On the GIST Support International website, there is a category for current trials, which can lead you to the trials that are open.
Okay.
And it will take you to the clinicaltrials.gov website, which is useful because you can then view all of the trial sites, which is very relevant to you to tell if it's geographically available or convenient, as well as gives you a contact for the trial. So that's what I think is the best way to find all of the trials that are open in one spot, current trials.
And there is a download feature in case you want to go to your physician with a beautiful Excel spreadsheet.
I didn't know you could do that.
Oh, I'll show you.
I just print out all the paper.
No.
Okay. Well, thank you. That's all the time we have for questions today. Thank you, everyone, for submitting the questions. Do either of you have anything you'd like to add before we go?
I just want to say that I really enjoyed this dialogue with you, ladies, but really my deep thanks to the patients and their families, because there is a generosity in every patient that comes to an enterprise like this, or in patients who enroll in clinical trials, because there is a lot of pain and sharing and suffering and operational problems that go with that, and we are deeply thankful for all what we can learn. And I would end by reminding everybody that just sharing their journeys is a way of helping patients just like them around the world. And that is something that we do not take lightly. There is a lot of generosity in this, so we thank you.
So I want to say thank you. GIST is my favorite tumor, so it's always a pleasure for me to be able to talk about it, especially with people who also share that passion. And I echo Fernanda's comments about patients and families in terms of their time at the clinic and also on clinical trials. That's how we learn and how we make progress for the next set of patients, and hopefully we can do it better for in the future. Thanks.
Okay, I'd like to remind viewers that this video will appear both on the National Cancer Institute Facebook page and on NCI's YouTube channel. Any questions in the comments that we did not get to today will be answered shortly. To find out more about the NIH GIST Clinic or to ask other questions on GIST tumors, please visit NCI's contact center at 1-800-4-CANCER or by email and live chat on cancer.gov. You can find other cancer clinical trials at trials.cancer.gov. Thank you all for tuning in to the latest social media event hosted by the National Cancer Institute. Thank you for joining us today.
Thank you, Becky.
Thanks.
U.S. Department of Health and Human Services, National Institutes of Health, National Cancer Institute, cancer.gov, 1-800-4-CANCER. Produced June 2018.